help if I start at the beginning. So these are your take-home messages from the Nerve Nerds. So thanks to Tom. Key points from his talk I felt was it was all about MTSP and you need to assess them all. Probably the whole classification system isn't really necessary anymore, but you need to be able to tell the difference between non-degenerative and degenerative injuries and whether those have got either a favourable or a non-favourable prognosis. But really importantly, you've got to make a diagnosis, and you've got various modalities that you can be using to make that diagnosis, but certainly clinical history and examination, key. And you need to have your MDT input. Chris emphasised the point that watch and wait is an active process. Active, it's got a dynamic process to it. You need to go find the nerve, not the nerve was never seen. You need to be able to assess your neuroma in continuity. HOPE is definitely not a surgical strategy. And then we talked about the tension test for those gaps. And quite broadly speaking, you're either trying to narrow it, bridge it, or bypass the gap, depending on your strategy. CY told us very clearly, if it hurts, release it, really important. And again, you need to be assessing your other nerve modalities. Consider all of your MSK components. So it's not just about a nerve, there are your surrounding biomechanics. And think about in your delayed procedures, there's going to be scarring and callus, and you might have a tethered nerve. And guess what? You need to make a diagnosis. So these are just my thoughts as well. You've got to own that patient and you've got to own the injury. These patients start their journey in our fracture clinics and they're often left festering there for months on end. Don't let that happen. Make sure that you, like I said, own it and do the appropriate things. Pre-op examination, my big bugbear. Every time I hear they're neurovascular intact, I don't believe it. The neural examination should be specific to what you're examining for, and it needs to be documented clearly. Get help early. You've got plenty of people around you. And therapy. Don't leave them in a position where they're going to end up with contractures, because then it's irrelevant what happens down the line. And finally, you need to make a, oh, hang on, we've talked about that. Thank you very much.
Kate, thank you for hosting. That was fantastic.
You guys did a great job. So I think that probably brings us to a close. I think Ramon wanted me to finish this up. So I'm probably just going to end the session. We've had a whole bunch of questions and answers, which I know we've been trying to answer en route, and the boys have been doing a great job as well of putting those answers online. Mike will at some point, I think, download all of those, put them on the website so you'll be able to access them. And you can obviously access this at a later date via the OrthoHub link. So many thanks, and we shall now end the session.